I just want to say thank you all for coming. When I was on the campaign trail last year, and then again when I was campaigning with our two senators, we would say, vote like your lives depend on it, because it does. And now we have delivered on that promise. This bill is about saving lives and about saving livelihoods. It has $70 billion for vaccinations, for building out our public health workforce, for contact tracing and testing, and making sure that we get this disease under control. There are many other very important provisions which the senators have mentioned, but I just want to go back and reemphasize something very important to me, to the 7th Congressional District, and to Georgia, and that is the very important changes that are going to be made around health care and health insurance. In my district, Georgia's 7th, 14% of our population, 120,000 people, lack health insurance, which means they lack that access to a doctor and to our health care system. And that was before the pandemic. These are working people. Some are too poor to be able to get a subsidy to purchase health insurance on the exchange. They were supposed to have been covered by Medicaid expansion, but of course, Georgia didn't do that, so they don't have access to health insurance. Others, however, simply can't afford to pay Georgia's very high health insurance prices. These are people in my community. They hold good jobs. They're often two-income families. They live in nice homes, but they still struggle to afford health insurance. I have heard stories of people who have to pay $2,000 and $3,000 a month to afford health insurance, and probably many of us here could not do that. The American Rescue Plan has a very important provision that caps health insurance premiums at 8.5% of income for everybody purchasing health insurance on the exchange. That is going to provide health insurance for so many Georgians. Additionally, Georgia is one of the 12 states in our country that has yet to expand Medicaid. The American Rescue Plan gives Georgia a second chance to do this with the higher federal matching rate. Expanding Medicaid would ensure health insurance for at least 500,000 people in Georgia, and it would help save the rural hospitals. With more people covered, we will reduce the cost of uncompensated care and dramatically lower our sky-high premiums. It's not just the right thing to do, it is a smart thing to do. The American Rescue Plan isn't just good politics, it's good policy for Georgia. Thank you all for coming, and I want to turn it over to my friend and colleague, Congressman Hank Johnson.